My original diagnosis was lung cancer, and I never smoked in my life. I went to see the doctor in the first place because I was having this continuous cough, and it wouldn't stop, and I just kept coughing and coughing, and I knew it wasn't normal. And the doctor, she kept switching me on my blood pressure medicine, but it wasn't the blood pressure medicine, so I had an x-ray done. That's when they found the lump in my left lung. The day I was diagnosed is probably one of the worst days of my life because I'm not ready to die. I was in stage 4. When I found out about the lung cancer, they told me without treatment, I probably had about 4 months, and then with treatment, maybe 2 years. That was with the chemotherapy. I found out that I had lung cancer, and then Kathy Robinson came in and told me I had a chance to be in a clinical trial that they was having here, but I had time to think about it, so I didn't make my mind up that day. I was real confused when they asked me about the clinical trial because there's a lot of papers. My gosh, there was probably 50 pages you had to read over, and different ones told me I'd probably be a guinea pig. They just used me, and I thought, I'm probably going to die anyway, so don't help me, I'll help somebody else. So I decided to go ahead and do it. I had chemo every week, but I had the infusion every 3 weeks for the clinical trial. Everybody that was in the chemo room was super nice to me. They made you feel like you was not alone. Every one of them girls was they was wonderful. I couldn't ask for anybody better care. I would recommend a clinical trial for anybody that it was offered to, because I think it gives you a chance to have a life a little bit longer. I'd say about in December, they said my cancer, it was 2 centimeters, and they said that it hadn't grown any at the time. And then when I had my last CAT scan, that would probably have been around February, they said they couldn't find no trace of the tumor even being there. The results of my clinical trial I found out about 3 weeks ago after my last CAT scan, and the nurse from Dr. Desai's office called me, and she said, I got great news, you're cancer-free, and I didn't believe it till I came back in and seen Dr. Desai the next Thursday, and she said that it was remarkable, and it's just hard for me to believe that I'm supposed to be okay for now. It was very, very good feeling. Different people recommend me go to Mayo's or Barnes's because they're so much better than what Springfield was, but I never had no doubts about coming to Springfield. Like I said, my son's a doctor here, and he thinks it's a wonderful place, and then I thought, it's so close to home, why do I want to go clear to St. Louis? And different ones told me that they don't do any more for you than they do right here in Springfield, so I had no qualms about coming here to Springfield, closer to home. But no, I have no regrets about my decision to come here.